and Food Administration in the U.S. has recommended new limits to a key ingredient in one of the most common medications in the world. More than 30 doctors, pharmacists, and researchers say the FDA should lower dosing levels of acetaminophen, saying large doses makes it easy for patients to accidentally overdose and suffer either liver injury or death. The recommendations could fundamentally change how we treat common colds, headaches, and pain.
As a pharmacist, Rebecca Drake knew very well the risk of overdosing on acetaminophen. What she didn't know was that her sister April was taking too much Tylenol to help relieve her pain.
And in a week or two, she ended up having acute abdominal pain and went to a local emergency room and there was found to be an acute liver failure.
Today, Rebecca told April's story to a panel of doctors and pharmacists investigating acetaminophen safety.
Unfortunately, her new liver proved to be too little too late.
After a liver transplant, April died late last year. One of 56,000 Americans who suffer liver damage each year after taking too much acetaminophen.
The concern is that acetaminophen is responsible for about half the cases of acute liver failure in this country.
And Americans often don't realize how much acetaminophen they're taking, since it's a common ingredient in pain and fever reducers, cold and flu medications, sleep aids, and prescription drugs.
We've heard time and time again during the last 2 days that acetaminophen is a, quote, safe and effective drug when used as directed.
Today, an FDA Drug Safety Advisory Committee said those directions need to change and recommended lowering the maximum daily non-prescription dose of acetaminophen. It now stands at 4 grams a day or 8 extra-strength Tylenol a day. The committee also said the maximum single adult dose should be 650 milligrams. And while extra-strength Tylenol recommends 2 500-milligram pills at once, the panel recommends that dose would require a prescription. Today, the drug makers said it was all an overreaction.
We believe that acetaminophen, if used as directed, is safe 99.9% of the time.